How do I know if my hot flashes and night sweats are from a hormonal issue? So, women don't usually say, I'm having vasomotor instability, what's wrong? They say, my face suddenly feels like I'm on fire. I'm in a meeting and I feel heat rising up my chest. I wake up drenched at 2 a.m. Or I think it's normal to keep the window open in the middle of winter. So, hot flashes are commonly tied to estrogen fluctuations, not just low estrogen. So in perimenopause, estrogen spikes up and down, very unpredictability. And your brain has temperature regulating centers that are sensitive to those estrogen levels. So when the estrogen drops suddenly, the brain interprets it almost like a thermostat malfunction. It overcompensates and blood vessels dilate and heat rises. Sweating begins and then you have your flash. Now, here's the part that gets missed. There are some things that sort of amplify these hot flashes. The first one is stress. So stress amplifies this dramatically. When cortisol is elevated, the nervous system is more reactive and temperature regulation becomes much more sensitive. So a woman who's under chronic stress and beginning to experience those estrogen fluctuation have more intense hot flashes, more frequent night sweats, and more emotional reactions to symptoms. The next thing that can really affect the whole process is progesterone. So progesterone and estrogen are like salt and pepper. And what happens in perimenopause is progesterone begins to lower well before the estrogen does. Well, progesterone's the calming hormone. So now you have low progesterone and fluctuating estrogen. And so you don't even have that calming piece in the middle of the day or throughout the day to help balance those hot flashes. Hi, I'm Dr. Casey Tramp. I'm a licensed medical doctor and functional medicine practitioner. I focus on helping women suffering with tough and challenging thyroid and hormone issues. My approach to complicated thyroid and hormone issues is very different from others. In my practice, I utilize the very best of traditional medicine along with the very best of functional medicine to help my patients regain their health and get symptoms under control. How do I know if my hot flashes and night sweats are from a hormonal issue? The final thing that can really affect hot flashes are blood sugar. So blood sugar, either too low or too high, can make people's hot flashes be amplified greatly. So when we think about hot flashes, I think about estrogen fluctuations, I think about low progesterone, I think about cortisol problems and blood sugar instability. There are so many layers to helping people feel their best. And one of the ways that we like to do things is to look at each layer and take the low hanging fruit and help get rid of those things first. So fixing your nutrition, helping your stress, adding on hormones when it makes sense can make a huge difference with hot flashes. Visit the link you see with this video to schedule a consultation with our office now. We'd love to explore how we can help you and any unresolved hormonal issues you may be dealing with.